Posterior approach to the humerus, a good exposure, lateral position, padded over a bolster, the forearm hanging down, always image before prepping, do the landmarks, the medial side is always towards the foot, there is no interlunar plane, the incision is between the long and the lateral head of the tricep, and you split the medial head. Identification of ulnar nerve is important. Pass tapes along the ulnar nerve to identify it all the time. Retract long and lateral head of the tricep to reveal radial head, to reveal the radial nerve, accompanied by profunda brachii artery. Mobilize the radial nerve and put a sling. Distally over olecranon along the proximal ulna, not easy extensile approach. Structure rate, radial nerve, 14 centimeter above the olecranon in the spiral groove, and pierces lateral intermuscular septum 7.5 centimeter proximal to radiocapital joint. Profunda brachii in artery is also at risk.